to read a PGX report, aka pharmacogenomic DNA test for drug metabolization via the CYP450 gene complex, in under 5 minutes. And keep it simple, please. First, forget about all the science. This really is genetic science, and it's as complex as that implies. But what really matters is the effect it has on flesh and blood people. So let's talk about a real case with real consequences. A young boy within the autism spectrum is taking multiple medications for ADHD symptoms. Antidepressants are being considered by the parents and the doctor. A typical scenario might start out with this 12-year-old being put on a low dose of Zoloft. Likely the patient and parents will see immediate placebo effect, but after a few weeks they report no benefits. Negative side effects may be present, including significant mood swings throughout the day, possibly deep and depressed thoughts at times. Higher dosages do not seem to have increased benefit. Patients and parents are frustrated, and eventually the doctor agrees a change may be in order. After a few months to a few years, the Zoloft gets replaced, perhaps with Elavil or Lexapro or Celexa, or maybe another medication is layered with the Zoloft. More months and years of careful monitoring see your 12-year-old, now a teen. Negative side effects may be chalked up to growing pains, or worse, to the patient's psychopathy, rather than the medications causing them. Eventually, if the risk to reward ratio just isn't working for the patient, they will resist taking their meds. Parents may pull out hair wondering what to do, and providers will increasingly question their own judgment as well as the compliance of the patient. Well into adulthood, this very real patient may have spent decades trying different antidepressants with no appreciable benefit. Worse, they may have suffered from those same drugs. Or we could do things differently. Let's go back to how to read a PGX report. Now, this particular patient's report is 56 pages long, but I'm going to show you where to look to possibly change the rest of this boy's life for the better, starting now. Because DNA never changes, we're getting insight, not just into what the patient is taking today, but whatever they will take from cradle to grave. This test lets you see the future and avoid critical drug and dosing errors. It starts with a mouth swab. After about a week, a very long report is delivered to the doctor with practical, actionable information and advice. On page 6, we see findings on the patient's current medications. That's good news that both ADHD meds that they're taking are effective choices for this 12-year-old boy. However, the next page shows some serious warnings. Remember, the parents and doctor are considering an antidepressant. Zoloft is cautioned against use, while other common meds like Elavil, Celexa, Lexapro are flagged. They are all rapid metabolizers, meaning that they will be digested before they can offer any benefit to the patient. Higher dosage would offer little improvement, but higher risk of side effects. Now look over to the left. You'll see a long list of medications that we know are a good fit for our young patient. Many of these drugs have long clinical histories of effectiveness, and some are less expensive for the patient. Most important, we know the patient should see intended benefits within recommended dosing guidelines. Why is this report so long? The reason this report is so long is because it contains over 40 pages of specific dosing guidance on hundreds of medications. When this 12-year-old boy is a 72-year-old man, his providers will still be using these results. A PGX test is a roadmap to those drugs that harm and those that can do harm, even for drugs that don't yet exist. Why is this test so important? The PGX test is so important because it makes doctors smarter. It improves the quality of life for a lifetime. It can even save lives tragically lost to well-intended treatment decisions. Via this report, we are always here to help. There, PGX in under 5 minutes.